Welcome, Nebraskans. Hey, it is May and it is Mental Health Awareness Month, so what a great time to be visiting with you. And this week happens to be Children's Behavioral Health or Mental Health Week that we're celebrating, so I hope you will too. We'll talk a little bit more about that at the end. But today, joining me, we have Francis, and Francis, thank you for being here today. And we have Michelle Nunemaker, who is our Youth System of Care Administrator, and she has been a great lead in our 988 planning. And so, thank you for joining.
Yes, thank you for having me today.
You bet. And we have so many great partners that have really been helping with 988. And you may be wondering, what is 988? And we're going to share that with you today. But the University of Nebraska-Lincoln Public Policy Center has been just instrumental for us in partnering in our grants and development and implementation and pulling stakeholders together. So we want to thank them and all of our stakeholders that have joined us. So today, Michelle, we wanted to talk about 988.
Yes.
So nationally, 988 has had the opportunity for all states to really think about their emergency and crisis system differently, right?
Yes.
And it's about having easy access, 3 digits, easier access to help in crisis.
Yes.
And they have talked about the opportunity to not only have 988, and we'll talk more about what that number is and what will happen when you dial, but thinking about the crisis system in kind of 3 components.
Yes.
The first one is, in order for us to save lives for people in mental health crisis or folks that might be experiencing ideas of suicide, we want to be able to have quick access. We want them to have someone to call.
Yes. That someone to call is a huge piece of the 3 pieces to the crisis continuum.
You bet, you bet. So someone to call, and then once you call, someone to respond is the second component. And in Nebraska, we have mobile crisis response teams that we have had for a number of years, but those will be getting even more geared up so that no matter where you are in Nebraska, someone will be able to respond in situations where it is warranted and needed to have someone come to your home.
Yep, come to your home, talk to you about what's going on in your home, talk to you about what you need, and really work on de-escalating the crisis and getting them connected with services.
Yeah, and that's the third one, is
Yes.
that, so someone to call, someone to respond, and somewhere to go or
Yep.
get connected, exactly what you talked about.
Yes, so that get connected piece is going to be huge. A big part of, I think, of 988 is a prevention aspect to it, and how can we connect individuals in the community with services that will help them, that should they find themselves in another space where they're feeling or going through a crisis, they have some tools already available and connections already made.
You bet, you bet. So many of you viewers may have seen or actually called or had family or friends call the 1-800-273-TALK or 8255 National Suicide Prevention Lifeline. And that's the number that is really transitioning to 988 as of July 16th. And so that number is the someone to respond.
That is our someone to respond. You dial that 988 number, and here in Nebraska, a 988 line will be answered by a crisis counselor through Boys Town in Omaha. They even have they even have crisis counselors who are not necessarily in the office and are working remote, but they're there in that Omaha area and know the resources in Nebraska.
You bet, you bet. So the big thing, the big news about the 988 is that 1-800-273-TALK line. Again, nationally, the big date is July 16th.
Yes.
And that number will transition to 988.
Yes. And you can still dial on July 16th. You're still able to dial the 1-800-273-TALK. You will still be connected to a crisis counselor. You can still also access the different warm lines that are available across Nebraska through our regional behavioral health authorities.
You bet. Yeah, there's great 24/7 crisis lines in each of our regions. There's 211. And one of the things that we talked about in the planning was trying to make sure if people were familiar with numbers, especially those local numbers, that they continued to have access. But 988 will always be there for them.
Absolutely.
You bet. So, Michelle, I know Boys Town is our current vendor with the National Suicide Prevention Lifeline, and they will be the vendor as we start with the 988.
Yes.
So, can you talk a little bit about what's that experience like?
When you call 988 or 1-800-273-TALK, you will actually be connected through Vibrant, which is a national vendor.
Yeah.
Press 1
Yes.
if you are a veteran,
Yes.
and will be connected to Veteran Services, or you can press 2 for Spanish, and you will be connected through Spanish services. Otherwise, you will then be transferred over to Boys Town, and at that point is when you will reach a live person that will say, hey, how can I help you?
You bet, you bet. So as we think about callers that might speak a different language or are deaf and hard of hearing, how do those connections happen with our 1-800-273-TALK and soon to be 988?
So currently, through Boys Town, through our vendor with Boys Town, they are able to provide services to the deaf and hard of hearing, and they also are able to do translation services through an agency that they contract with for over about 400 different languages.
That's great.
All of which are covered here in Nebraska.
That is great. And one of the other things about 988 with the technology changes that are happening is people will be able to text and chat. And Boys Town will be working on and testing some of that technology here over the next several weeks.
Yes.
Getting ready for July 16th.
Yes, we're excited to hear about how that goes and what that looks like, and be able to provide that opportunity for individuals outside of just calling over the phone.
You bet. So one of the things that's important as we make that transition from 1-800-273-TALK to 988 is that people understand that experience that you described.
Yes.
Because right now, if you call 911, typically you will get a live voice right away. The dispatcher will ask you some questions, and maybe medical emergency personnel will be dispatched. It might be law enforcement, but generally you get that live voice. With the Vibrant technology and the opportunity to press 1 for veterans or 2 for Spanish speaking, there is a lead-in, and it will take maybe 30 to 40 seconds,
Yes.
but you will get a trained live counselor.
Yes, you will. Just hang on there as they connect you through to Boys Town.
You bet. And then again, as we learn more about that text and chat feature, we'll continue to keep all of you informed about that transition.
Absolutely.
So, you bet. So, Michelle, one of the things that someone to call, someone to respond,
Yep.
and someplace to go and get connected. What are some of the things that if you were a Nebraskan that is just hearing about 988 today, what would you be excited about that's going to happen July 16th?
I think the first thing I'm excited about is that I'm connected with somebody here in Nebraska, and I'm connected with trained crisis counselors who know the resources in Nebraska. And then I love the aspect of being able to activate mobile crisis response and having either an individual or a team of behavioral health professionals come to wherever you are in the community. Whether I'm at home, could be at work, I could be at the park. I mean, they can come to
At school.
Anywhere that the person is at and is experiencing that crisis. So I'm very excited that they will be going to the individual.
So, and we know from other states and nationally, and talking with other states about the someone to respond and somewhere to go, that the call centers, because of their training and the triage tools,
Yes.
do such an excellent job that much of the time, they are able to be, I think it was 80%
Yes.
they're anticipating people will be able to call, get connected, and not necessarily have to have mobile crisis respond. But in the event that they need to be activated, to have somebody that can respond quickly will be amazing.
And I'm very excited that we have teams that will respond for adults and teams that will respond specifically to children and youth and families, as those needs can be so different. And it's important that staff or that the teams are trained on how to work with the population that they're working with.
You bet. And even the mental health and substance use, or maybe both issues, are being experienced.
Yes.
And so, they're great teams. And right now, we know that for both the adult and youth mobile crisis response teams, as we look at their data, about 75% of the time, they are able to address the crisis, get them connected to services, keep them in home, but make that really important connection to access help.
Yes, and the follow-up services that individuals will receive through mobile crisis response, that somebody will follow up with them within the next 24 to 72 hours, check on how are they doing, how are they feeling, if a safety plan was developed, how's that plan going, were they able to get access to the services they were referred to? If they were not able to, what was the barrier? And that mobile crisis team will work with them to try and address that barrier and get them still connected with ongoing services.
Sure, and that I love that you brought up the follow-up, because that is important. Not only do we want to save lives, but we want to make sure that folks are able to not have difficulty navigating the system, that folks can get connected. And so that follow-up is important. In fact, the call center, the 988 call center, will make a follow-up call as well, even if you didn't have to have mobile crisis response.
Yes, they will still follow up, and same thing, they will call or contact the individual how they prefer, and just ask how they're doing. Were they able to access services again? And if there's were barriers, they will work with them to address those barriers. So I'm very excited that there will be individuals and teams out there to help break down those walls and break down those barriers for people.
You bet. And I'm excited about the easier dialing, because 1-800-273-TALK is still going to be there, but dialing 3 digits is going to be really great access. And then that text and chat feature,
Yes.
That's a lot more comfortable for people, younger people.
Yes.
There's a variety of opportunities there with the text and chat.
I agree. I agree.
Yeah, so folks in Nebraska, the implementation team that you've led, thank you for your leadership. We still have a lot of work to do between now and July 16th, and there's going to be a lot more work after that. Just because we're going to have things going live with the 988, we're still calling it a soft launch.
Yes, because we will still be working on bringing up those mobile crisis teams as we have a better idea of here in Nebraska how many of those crisis calls are not able to be de-escalated over the phone, and how often are mobile crisis teams having to go out. So there will be that aspect that we'll be looking at. And at the same time, we're going to continue planning to bring up a robust crisis continuum just in the community and for individuals to have access to.
You bet. Well, we're going to be doing a lot more of these, and get out in the communities and make sure as many folks in Nebraska know between now and July 16th what's coming. But we have a website here in the DHHS that has all things 988. That's great. And it has all the past webinars that the implementation team has been doing, documents. It'll get our marketing and messaging. There's a lot of hard work that's going on. So lots of information to keep everybody informed.
Yes, and I would just plug those stakeholder webinars one more time, because those have been great with being able to articulate what does mobile crisis response look like. That was just our last webinar. Whereas one prior to that was, what does that phone call look like? What is that experience? So there's some great information on those webinars. It also goes over the work that's been done on the work teams, and that's a great place to go get additional information about what's happening in Nebraska.
You bet. So before I issue our wonderful viewers a challenge, talk a little bit about the stakeholder advisory committee that will be ongoing for our 988 efforts.
Yes, so we will continue to have stakeholder advisory webinars and meetings, and the big piece of that is we're going to be looking to our stakeholders to help us identify what's working really, really well, maybe some areas that we need to tweak a few things, things maybe aren't working very well, and areas where we have room to grow, and be able to include our stakeholders so that we're getting information from Nebraska's out west and Nebraskans up north and our people with lived experience. We want to hear from everyone to make 988 and the crisis system beneficial for you.
That's great. Okay, so thanks for joining today, but your work is not done. So I'm going to issue a challenge, and Michelle will continue to do this as we have more stakeholder webinars.
Yes.
So keep in mind the number 988. So this week, those of you who are watching, please reach out to 9 family or friends. Okay, that's the first digit in 988. So if you reach out to 9 family and friends and let them know that 1-800-273-TALK is transitioning to 988 on July 16th. And the second week,
We'll do 8, Sheri.
there you go. So then if you tell 8 family and friends, and then the third week,
We do another 8.
there you go. So the challenge is that each viewer will reach out. If they take their 988 in those 3 weeks, you will reach at least 25 people. And so we want to spread the word, and we'll keep informing you of what's happening and get some marketing and messaging about this transition. So I hope you please take us up on the challenge. Put a comment in as you're watching the video about the great work that you're doing to help us get the word out. So Michelle, I'm going to let you close her out here with 988. What's exciting? What do you want our viewers to be left with?
The one thing I really want our viewers to be left with is that quick dial to 988. You will reach a trained crisis counselor who will work with you through any kind of crisis, whether it be a mental health or a substance use crisis. The 988 is more than just a suicide prevention lifeline. It is really there for crises, for any behavioral health aspect.
Very good. So we're excited about 988 in Nebraska. Lots of hard work and more to come.